Hello, this is Dr. Albert Wong, neurosurgery, demonstrating an endoscopic transforaminal microdiscectomy through revision territory surgery. This is a pleasant 78-year-old lady with a prior history of an L4 to S1 pelvis posterior spinal fusion many years in the past, with bad scoliosis, as well as a prior history of a T12 to L4 decompression or a hematoma in the past. She now presents 3 years later with severe back pain and leg pain with weakness and bladder and bowel incontinence. Here on her MRI on the left side, it's a sagittal view that's looking at her from the side, so her head is up here, her legs are down here, her stomach is here, her back is here. These gray squares are the bony parts of her spine, and these gray rectangles in between them are her discs. Those are shock absorbers to her spine. You can see that she has no disc here at the T12L1 region. She has a large disc herniation here that we're circling with this red marker. You see it's pretty sizable and it's hiding behind the T12 vertebral body. This gray column here is her spinal cord, which is just out of view because of her scoliosis, and she has severe compression of her spinal cord at that level. And here on the right side, you can see that she has the large disc herniation here, also circled in red. You can see her spinal cord is just below that, and that's also severely compressed. So for her surgery, she has multiple options. We discussed her case at our multidisciplinary neurosurgery spine group. There were multiple different solutions. Some advocates suggested extending her spinal fusion up to T10 towards her middle back, all the way down to the pelvis, correct her scoliosis, as well as remove the disc herniation. However, that's a very large and complex surgery for a 78-year-old and a fairly frail lady. Her main complaint really was the bilateral leg pain and weakness and the bladder and bowel incontinence. We discussed doing a minimally invasive endoscopic transforaminal surgery where we would approach the disc herniation through the normal entry hole for where the nerves exit out of and come in from the side. And this would allow us to bypass her lungs and her kidneys safely, bypass her important blood vessels, avoid the disc herniation here, avoid the spinal cord back here, and avoid all the prior surgical scar tissue she has in the back.